The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey everyone, this is Jonathan Marks. Welcome back to Go to Health Media. We have another good show for you today. Today we have somebody who has braved cancer and who wants to share her story with others who might follow in her footsteps. Kristen Foreman, who you'll meet shortly, was in her early 30s when she noticed menstrual cycle irregularities. She persisted in raising her concerns and after many tests was diagnosed with endometrial cancer, and we'll talk more about what that is. Kristen underwent a hysterectomy, 6 cycles of chemotherapy, and a month of radiation. There's about 61,000 cases of endometrial cancer that are expected to be diagnosed in the U.S. each year, and according to the American Cancer Society, this kind of cancer affects mostly post-menopausal women. The average age of women diagnosed with endometrial cancer is 60. With us also today is Dr. Sharyn Lewin, Director of Gynecologic Oncology at the Holy Name Medical Regional Cancer Center in Teaneck, New Jersey. She is recognized both nationally and internationally for her acumen in performing laparoscopic, robotic, and open surgery to treat complex gynecologic cancers and related malignancies. As president and executive director of the nonprofit Lewin Fund to fight women's cancers, Dr. Lewin is dedicated to eliminating medical, economic, and psychosocial challenges faced by women with the cancer. Welcome to the show, Kristen and Dr. Lewin. How are you both today?
Doing well. Thank you for having us.
Doing well.
Good.
Thank you for having us.
Pleasure. So, Kristen, let me ask about the experience you went to. And I want to thank you so much for coming on the show today to share your experience and how you want to alert other people to this possibility. What are the signs and symptoms you experienced related to endometrial cancer when this started?
The key symptoms that I experienced were fatigue, bloating, and bleeding in between my menstrual cycles.
And that's what tipped you off and you saw a doctor, and did it take a long time to get diagnosed?
My way of gauging the symptoms was to monitor to see how long they would proceed. And after 1 month, I realized that they were pretty consistent and they were still continuing, specifically the intermittent bleeding. And that was an indicator that I definitely needed to follow up with both my PCP and my gynecologist to make them aware of those changes.
And how have you dealt with this emotionally? This must have been a big impact on your life. And how was it during the process, and how is it living today?
During the process, some points just felt like a haze because everything happened so quickly, from the symptoms to the diagnoses. But I will say that what has kept me in a positive mindset, what helps me along the way, is to know that I have an amazing support system in my family and friends. And I also find it gratifying just letting other women that have been diagnosed as well to know that they have, they're not alone, and they have other women such as myself that would be just honored to share with them resources, time, and just whatever they feel would help them along the way to be an additional support outside of family and friends.
Good. I have so much respect for what you're doing and wanting to get the word out about what you've experienced and share that with so many. Dr. Lewin, let me ask you a few questions. What is endometrial cancer exactly? Can you describe that for us?
Absolutely. So the endometrium is the lining of the uterus. And so it's a cancer that actually starts in the lining of the uterus. We call it endometrial cancer. It's actually the most common gynecologic cancer that we see. There are over 61,000 women who are diagnosed in the United States every year. Gynecologic organs are the reproductive organs of the female reproductive tract. What we see now, though, however, it's one of the most fatal forms of gynecologic cancers. And so thank you so much for the opportunity, to talk about this and educate people today.
And what are the risk factors for this kind of cancer? Who gets it? Is there a family history people should be looking for? Lifestyle issues? Are there some early warning signs so people can catch this earlier? Even, I don't know if you can prevent it, but at least catch it early.
That's a great question. So there are definitely some things that women can do. We do know that obesity is one major risk factor for some types of endometrial cancer. And we know that obesity is a major problem in the United States. Actually, obesity is now linked to 13 different kinds of cancers, including endometrial cancer. So actually staying in an ideal body weight is one important form of prevention. And that's because when women are overweight, they have too much circulating estrogen in their body, and that hits the uterus and then turns into an endometrial cancer. So that's one important form of prevention, is to stay in an ideal body weight, also to eat healthy and to exercise. So there's actually a lot of published literature on the importance of this. Actually, on that vein, half of all cancers in the United States could be prevented with ideal body weight, exercising, healthy diet, not smoking, and limiting alcohol. So since we're talking about this subject, so staying in an ideal body weight for endometrial cancer is very important. We also know that there are some genetic predispositions. There's something called a Lynch syndrome. This is a genetic mutation. There are genes that can be mutated. 1 in 300 men and women can carry this mutated gene, similar to like the BRCA or the BRCA mutated gene, where women at young ages may get endometrial cancer. Also, families may have colon or ovarian or stomach cancer. Those are the most common cancers in these syndromes. But some of these forms of endometrial cancer, particularly these advanced cancers that we're seeing, and often in underserved populations, we don't really have a reason for why these cancers are happening. And that's something that we're investigating pretty actively now in our societies. We've made several advances in treating endometrial cancer. I mean, most notably, immunotherapies or agents that work with the body's immune system have been approved by the FDA. This has led to a very meaningful advance for women that have advanced endometrial cancer or cancer that is spread outside the uterus or has recurred. Specifically, dostarlimab or Jemperli has been approved by the FDA in combination with chemotherapy, specifically carboplatin and paclitaxel. These are our standard chemotherapy drugs. For women with advanced endometrial cancer that has spread outside the uterus or recurred, followed by maintenance with this immunotherapy. This has been a very meaningful advance for our women with this disease. It's important to note, though, that immunotherapies can have some unique and serious side effects. So it's important that women do speak to their doctors about their medical histories and whether or not they are experiencing any of these side effects.
And let me ask one other question, Doctor, and then we'll come back to you, Kristen. Do risk factors increase based upon ethnicity or age? Tell us a little bit more about the demographics of people who get endometrial cancer.
Most women are post-menopausal, and so it's important to tell people that if there is any bleeding after menopause, post-menopausal bleeding or discharge, that should prompt a visit right away to the gynecologist for a biopsy. Any bleeding after menopause is definitely abnormal. But we also want to tell younger women, like Kristen's age, for example, if there's any bleeding in between periods or any change in the menstrual cycle, that also can be abnormal too. And women definitely need to be evaluated right away with their gynecologists and have a biopsy. We do know too that half of all women diagnosed with endometrial or gynecologic cancer don't know the signs and symptoms. So many women stop seeing their gynecologists after they have babies. It's really important that women see their gynecologist every year. Most of these cancers develop as women age, postmenopausally, and that's a very important time that women absolutely need to continue seeing their gynecologist every year, really regardless of age.
And Kristen, let me ask you, did you have a family background or did you have this genetic anomaly that became apparent? Tell us a little bit about how this developed in you. And was it in your family? What was your experience?
I was aware of my family's history of breast cancer. However, I was unaware that could be a predisposition or predeterminer for my particular diagnosis. So that was definitely eye-opening to find that post-diagnosis, because I wasn't aware of that initially. But as far as family history, I was aware of a few aunts that were diagnosed.
So you really kind of looked into your family history to see it. And what I'm hearing from both of you is if there is a family history, you should get checked out by your doctor, and particularly your gynecologist. I didn't know that women tend to stop seeing. Who do they stop seeing after they have a baby? Did you say, doctor?
They often stop seeing their gynecologist once they have babies. And unfortunately, these cancers are more prevalent as women age. So I think an important message is to definitely see your gynecologist every year, regardless of age.
So, Kristen, if you had just a few messages to get out to women, what would they be?
The main message would be to definitely listen to your body and be mindful and proactive if you do experience any irregular changes within your body. And the proactivity piece comes in terms of letting your doctors know, making your care team aware, because although they could be minor concerns, you don't want to overlook them. So I think you're making sure that your care team is aware, and always just listening to your body in general. And the other piece I would definitely encourage is that women advocate for themselves by way of getting a second opinion if they feel that those symptoms are being minimized, and just remembering that you are your own best advocate. Although physicians can assist you with any concerns, no one knows your body like you do.
That's a very important message. Thank you. Being a cancer survivor now, tell me what life is like. Do you worry about it? Is life normal? Do you tell us a little bit more about the quality of life in being a cancer survivor?
I think thank you for asking that question. I think the misconception is that this journey stops after treatment, but it doesn't. There's not a day that goes by that I don't think about my diagnosis and all that came with it. Mm-hmm. But I have to continuously remind myself, as well as those that also know about my diagnoses, that it is not it's a part of me, but it doesn't define me. So I think that is what helps me along the way. But yes, there's not a day that goes by that I don't think about it.
Yes. Thank you for sharing this with us, with me. It's very instructive. Doctor, tell us a little bit more about your Lewin Fund to Fight Women Cancers.
So this is a 501c nonprofit. It actually started from a grateful patient who passed away from an advanced form of uterine cancer. She left a bequest in her will for us to start a nonprofit to support women with gynecologic cancers and other women's cancers. Our board is entirely voluntary. It's a passion project for us. We are supporting research to help make advances in this disease. We're also supporting peer mentoring programs like the Woman to Woman program, really key support programs for women, transportation programs, food and pantry support programs, psychosocial support programs, education and advocacy support programs. So thank you for asking about it. There's just so much need that needs to be out there to help women with cancer.
Great. So this is the Lewin, Lewin, Lewin Fund to Fight Women's Cancers.
Yes.
Thanks so much for being with us today. I'm really glad to help get this message out. We've been talking with Kristen Foreman. She's a survivor of endometrial cancer, and Dr. Sharyn Lewin. She's the director of Gynecologic Oncology at the Holy Name Medical Regional Center in Teaneck, New Jersey. Thanks so much for being with us today, both of you. We'll look forward to getting your word out.
Thank you for having us.
Good. And as we say to everybody at the end of the show, remember, go to health. Take care. See you next time. Bye-bye. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.